This is the time of year when there is considerable focus on diabetes. Diabetes is a chronic, progressive, non-communicable metabolic disease characterized by elevated levels of blood sugar. The conditions occur either when the pancreas does not produce enough of the insulin hormone, which regulates blood sugar, or when the body cannot effectively use the insulin it produces. When diabetes is not detected early and not properly controlled, the health consequences are dire. Diabetes can damage the heart, blood vessels, kidneys, eyes, and nerves, resulting in lower limb amputations and other serious complications such as disability, job loss with reduced household income, as well as significant psychological problems. According to the International Diabetes Federation, Diabetes Atlas, currently 537 million adults around the world are living with diabetes. The new figures highlight the alarming growth in the incidence of diabetes worldwide, with the most poignant and devastating increases seen in developing countries. To be more specific, according to the World Health Organization and the International Diabetes Federation, 1 in 10 adults around the world are currently living with diabetes. The total number of people with diabetes is predicted to rise to 643 million by 2030 and 783 million by 2045. Over 4 in 5, 81% people with diabetes live in low and middle income countries. An estimated 44.7% of adults living with diabetes, that is 250 million people, are undiagnosed. Diabetes was responsible for an estimated US 966 billion in global health expenditure in 2021. This represents a 316% increase over the last 15 years. 6.7 million adults are estimated to have died due to diabetes or its complications in 2021, 1 death every 5 seconds. Undoubtedly, the global statistics are startling. Hence, we must collaboratively advance the fight against diabetes, particularly when the World Health Organization has identified diabetes to be the 7th leading cause of death worldwide. On the local level, the number of registered cases at community-based health centers increased by 603 cases over the period 2016 to 2020, reflecting an average of 120 new cases per year. Of the total, 60% are female, and 95.8% of the total registered clients are diagnosed with type 2 diabetes, with a 50% death increase from 2015 to 2018. It is undeniable, therefore, that among the non-communicable diseases, diabetes remains a threat to the Ministry of Health and the quality of life of the Federation's citizens. Having recognized that persons with multiple comorbidities are at an increased risk of contracting and dying from COVID-19, it is critical that everyone adopts measures to prevent and/or improve the management of diabetes. I am therefore very pleased that the local Diabetes Association continues to collaborate with the Ministry of Health to bring awareness to diabetes and mitigate against the incidence of diabetes. I am also delighted that the Diabetes Association is partnering with the International Diabetes Federation to advance this year's theme, Access to Diabetes Care. If not now, when? The theme amplifies the message regarding the importance of increasing access to diabetes care to improve diabetes management, prevent complications, and enhance the quality of life of people living with diabetes by addressing poor nutrition, physical exercise and obesity, smoking and alcohol abuse, as well as providing access to safe and effective medicines and treatment such as insulin. The Federation, through the Ministry of Health, continues to invest in the necessary resources to enable increased clients' access to the vital primary and tertiary levels of care, and the Ministry of Health also persists in its efforts to counteract the incidence and reduce the burden of diabetes-associated morbidity and mortality in the Federation. Also worth noting is that the Health Promotion Unit of the Ministry remains steadfast in promoting its NCD-related deliverables, which include a chronic metabolic disease project and a diabetic self-management program to build capacity in NCD prevention and management. The Ministry's SK and Moves program, which focuses on the 3 pillars of healthy eating, increased physical activity, and regular health screening, is gaining momentum and considerable buy-in to counteract the burden of NCDs on the healthcare sector and the significant negative impact on individuals, families, and communities. The initiative has been integrated into the Prevention and Control of Non-Communicable Diseases program in the Health Promotion Unit, with its main aim being to foster a healthy lifestyle culture and empower the people of St. Kitts and Nevis to engage in informed health-related decision-making. It is noteworthy to indicate that 2021 signifies 100 years since the discovery of insulin, one of the 20th century's greatest medical breakthrough, which is still the only effective treatment for type 1 diabetes. I am extremely pleased that the citizens of St. Kitts and Nevis, unlike certain countries, have equitable access to this life-saving medicine when, after 100 years since the discovery of insulin, access to diabetes care continues to be a challenge in many countries. The Ministry of Health applauds the St. Kitts Diabetes Association for recognizing the imperative and undertaking its mission to promote diabetic education in the Federation and empower persons with diabetes to appropriately self-manage their condition, to develop and disseminate educational materials to improve knowledge base regarding control and management, to facilitate free exchange of knowledge with respect to diabetes among health workers, and to foster strong partnerships with family members as supporting persons within the household to enhance and ensure clients' compliance to treatment. The Ministry is in strong support of the Association's Proclaim Diabetic Gospel, encompassing the acronym TEAM, which stands for T, testing regularly, E, exercise regularly, E, eat wisely, and M, comply with the recommendation for prescribed medication and care. Clearly, if the principle of TEAM is embraced by persons with diabetes and other citizens, there would no doubt be a significant decrease in the incidence and severity of complications. The Ministry therefore joins with the Association and make a call for citizens to buy into TEAM and to rally with the Diabetes Association. The Ministry recognizes the number of persons with diabetes continues to increase in the Federation. It cannot fight this disease on its own. Therefore, partnerships with entities such as the National Diabetic Associations are critically important. The prime purpose of this week, therefore, is to fundamentally promote an increased awareness of diabetes and to propel citizens to access the essential primary healthcare services available to persons living with diabetes, and to garner greater societal support to mitigate against the negative implications of the disease. The Diabetes Association of St. Kitts and Nevis will be observing its week of activities starting November 14th to 20th, 2021, to emphasize the message that individually, collectively, and consistently, we should ensure that every affected person has access to education and the care required. As such, the association's activities surround the variables of good health and wellness and access to care and treatment. They include a church service which was held on Sunday 14 at the Pro-Cathedral of St. George's, Bastille. A roundtable panel discussion on access to diabetic care at ZIZ 8:30 p.m. on Monday 15th November. Schools Symposia Tuesday 16 to Thursday 18th November. And the annual Diabetic Screening Day Independence Square Friday 19th November. It concludes on Saturday 20th with a World Diabetes Day Grand Walk for and with persons living with diabetes from the War Memorial to the ECCB roundabout and back, commencing at 6 a.m. The Ministry of Health is justifiably grateful and immensely appreciative of the invaluable role the Diabetes Association is playing relative to persons living with diabetes. Thus, I encourage all citizens and residents in the Federation to strongly support and participate in the Association's week of activities. On behalf of the Ministry of Health, I commend the executive and members for their meritorious service to this vulnerable group and the people of the Federation. And at this period, the Ministry of Health also stands in solidarity with all persons living with diabetes and urges everyone to take full advantage of the quality services available in the Federation. It is therefore with great pleasure that I officially declare the St. Kitts Diabetes Association's Week of Activities open. Thank you, and may God continue to bless the Federation of St. Kitts and Nevis.